Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Transcatheter valve replacement in severe tricuspid regurgitation. Background. Severe tricuspid regurgitation is associated with disabling symptoms and an increased risk of death. Data regarding outcomes after percutaneous transcatheter tricuspid valve replacement are needed. Conclusions. For patients with severe tricuspid regurgitation, transcatheter tricuspid valve replacement was superior to medical therapy alone for the primary composite outcome, driven primarily by improvements in symptoms and quality of life. The next article. Plozasiran for managing persistent chylomicronemia and pancreatitis risk. Background. Persistent chylomicronemia is a genetic recessive disorder that is classically caused by familial chylomicronemia syndrome, FCS, but it also has multifactorial causes. The disorder is associated with the risk of recurrent acute pancreatitis. Plozasiran is a small interfering RNA that reduces hepatic production of apolipoprotein C3 and circulating triglycerides. See inclusions. Patients with persistent chylomicronemia who received Plozasiran had significantly lower triglyceride levels and a lower incidence of pancreatitis than those who received placebo. The next article. Talquetamab plus Teclistamab in relapsed or refractory multiple myeloma. Background. Talquetamab, anti-G protein-coupled receptor family C group 5 member D, and Teclistamab, anti-B cell maturation antigen, are bispecific antibodies that activate T cells by targeting CD3 and that have been approved for the treatment of triple-class exposed relapsed or refractory multiple myeloma. The incidence of grade 3 or 4 infections with Talquetamab plus Teclistamab was higher than has been observed with either therapy alone. A response was observed in a high percentage of patients across all dose levels, with durable responses with the recommended Phase 2 regimen. The next article. Clearance of driver mutations after transplantation for myelofibrosis. Background. Allogeneic hematopoietic stem cell transplantation is the only curative treatment for myelofibrosis. Driver mutations are the pathophysiological hallmark of the disease, but the role of mutation clearance after transplantation is unclear. Conclusions. In patients with myelofibrosis, clearance of driver mutations at day 30 after transplantation appear to influence relapse and survival, irrespective of the underlying driver mutation. The next article. A comparison of peripherally inserted central catheter materials. Background. New catheter materials for peripherally inserted central catheters, PICCs, may reduce the risk of device failure due to infectious, thrombotic, and catheter occlusion events. However, data from randomized trials comparing these catheters are lacking. See conclusions. Among adults and children who were referred for PICC placement, the risk of device failure due to non-infectious or infectious complications was not lower with hydrophobic or chlorhexidine PICCs than with standard polyurethane PICCs. Next, we will be discussing articles from Journal of American Medical Association. Changes in patient care experience after private equity acquisition of U.S. hospitals. Question. How did measures of patient care experience change after private equity acquisition of U.S. hospitals? Findings. In this difference in differences analysis of 73 private equity acquired hospitals and 293 matched control hospitals, global measures of patient care experience worsened after private equity acquisition of hospitals, as did patient-reported staff responsiveness. The difference in these measures of patient care experience at private equity acquired hospitals compared with matched control hospitals increased with each subsequent year after acquisition, meaning patient-reported care experience, an important dimension of care quality, worsened after private equity acquisition of U.S. hospitals. The next article. Oral glucose-lowering agents versus insulin for gestational diabetes. A randomized clinical trial. Question. In gestational diabetes, is a sequential oral glucose-lowering medication strategy of metformin and additional glyburide, if needed, non-inferior to insulin treatment for prevention of large for gestational age infants? Findings among 820 participants randomized to oral glucose-lowering medication. 23.9% of infants were large for gestational age compared with 19.9% randomized to insulin, a difference that did not meet the pre-specified criteria for non-inferiority, meaning treatment of gestational diabetes with sequential oral glucose-lowering medication did not meet criteria for non-inferiority compared with insulin, with respect to the proportion of infants born large for gestational age. Next, we will be discussing articles from Annals of Internal Medicine. Cardiovascular Safety and Fracture Prevention. Effectiveness of Denosumab versus oral bisphosphonates in patients receiving dialysis. Background. Dialysis patients have high rates of fracture morbidity, but evidence on optimal management strategies for osteoporosis is scarce. Objective. To determine the risk for cardiovascular events and fracture prevention effects with Denosumab compared with oral bisphosphonates in dialysis-dependent patients. Conclusion. It was estimated that, compared with oral bisphosphonates, Denosumab lowered the risk for fractures by 45% and increased the risk for MACE by 36%. The estimates, however, are imprecise and need to be confirmed in future studies. The next article. Assessing the risk for falls in older adults after initiating Gabapentin versus Duloxetine. Background. The evidence informing the harms of Gabapentin use are at risk of bias from comparing users with non-users, but objective. To describe the risk for fall-related outcomes in older adults starting treatment with Gabapentin versus Duloxetine. Conclusion. Compared with incident use of Duloxetine, incident use of Gabapentin was not associated with increased fall-related visits. Next, we will be discussing articles from British Medical Journal. Time to nursing home admission and death in people with dementia. Objective to summarize available evidence on time to nursing home admission and death among people with dementia, and to explore prognostic indicators. Conclusions. The average life expectancy of people with dementia at time of diagnosis ranged from 5.7 years at age 65 to 2.2 at age 85 in men, and from 8.0 to 4.5, respectively, in women. About one-third of remaining life expectancy was lived in nursing homes, with more than half of people moving to a nursing home within 5 years after a dementia diagnosis. Prognosis after a dementia diagnosis is highly dependent on personal and clinical characteristics, offering potential for individualized prognostic information and care planning. Next, we will be discussing articles from Lancet. Induced pluripotent stem cell-derived CD19-directed chimeric antigen receptor natural killer cells in B-cell lymphoma, a Phase 1, first-in-human trial. Background. FT596 is an induced pluripotent stem cell, iEPS derived chimeric antigen receptor, CAR, natural killer, NK, cell therapy with 3 antitumor modalities, a CD19 CAR, a high-affinity, non-cleavable CD16 Fc receptor, and interleukin-15 receptor fusion. In this study, we aimed to determine the recommended Phase 2 dose, RP2D, and evaluate the safety and tolerability of FT596 as monotherapy and in combination with rituximab. We also aimed to evaluate the anti-tumor activity and characterize the pharmacokinetics of FT596 as monotherapy and in combination with rituximab. Interpretation. FT596 was well tolerated as monotherapy or with rituximab, and induced deep and durable responses in patients with indolent and aggressive lymphomas, and the RP2D was preliminarily identified to be 1/8 times 109 cells, for 3 doses per cycle. This study supports that cell therapy using EPCT-derived, gene-modified NK cells is a potent platform for cancer treatment, and suggests that such a platform might address limitations of currently available immune cell therapies. including manufacturing time, heterogeneity, access, and cost. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Cancer Journal for Clinicians. Breast Cancer Statistics 2024. This is the American Cancer Society's biennial update of statistics on breast cancer among women based on high-quality incidence and mortality data from the National Cancer Institute and the Centers for Disease Control and Prevention. Breast cancer incidence continued an upward trend, rising by 1% annually during 2012 to 2021, largely confined to localized stage and hormone receptor-positive disease. A steeper increase in women younger than 50 years, 1.4% annually, versus 50 years and older, 0.7%, overall, was only significant among white women. Asian American/Pacific Islander women had the fastest increase in both age groups, 2.7% and 2.5% per year respectively. Consequently, young Asian American/Pacific Islander women had the second lowest rate in 2000, 57.4 per 100,000, but the highest rate in 2021, 86.3 per 100,000, alongside white women, 86.4 per 100,000, surpassing black women, 81.5 per 100,000. In contrast, the overall breast cancer death rate continuously declined during 1989 to 2022, by 44% overall, translating to 517,900 fewer breast cancer deaths during this time. However, not all women have experienced this progress. Mortality remained unchanged since 1990 in American Indian/Alaska Native women, and black women have 38% higher mortality than white women despite 5% lower incidence. Although the black-white disparity partly reflects more triple-negative cancers, black women have the lowest survival for every breast cancer subtype and stage except localized disease, with which they are 10% less likely to be diagnosed than white women, 58% versus 68%. Highlighting disadvantages in social determinants of health. Progress against breast cancer could be accelerated by mitigating racial, ethnic, and social disparities through improved clinical trial representation and access to high-quality screening and treatment. Here are the articles from Journal of Clinical Oncology. Minimally invasive assessment of peripheral residual disease during maintenance or observation in transplant-eligible patients with multiple myeloma. In multiple myeloma, measurable residual disease, MRD, is assessed in bone marrow, BM. However, less invasive evaluation of peripheral residual disease, PRD, in blood, could be advantageous and less cumbersome. We investigated the prognostical value of PRD monitoring after 24 cycles of maintenance in 138 transplant-eligible patients with enrolled in the GEM 2012 MENOS65/GEM 2014 main clinical trials. PRD was assessed using next-generation flow, NGF, and mass spectrometry, MS. Positive PRD by NGF in 16,138, 11.5%. Patients was associated with a 13-fold increased risk of progression and/or death, median progression-free survival, PFS, and overall survival, OS, were 2.5 and 47 months, respectively. Considering patients' MRD status in BM as the reference, PRD detection using NGF showed positive and negative predictive values of 100% and 73%, respectively. Presence of PRD helped identifying patients at risk of imminent progression among those with positive MRD in BM. Patients with undetectable PRD, according to both NGF and MS, showed 2-year PFS and OS rates of 97% and 100%, respectively. In multivariate analyses including the revised International Staging System and the complete remission status, only MRD in BM and PRD by NGF showed independent prognostic value for PFS. This study supports the use of less invasive PRD monitoring during maintenance or observation in transplant-eligible patients with MM. Here are the articles from Journal of Hepatology. Effect of pemvidutide, a GLP-1/glucagon dual receptor agonist, on MOSLD. A randomized, double-blind, placebo-controlled study. Pemvidutide is a GLP-1/glucagon dual receptor agonist. Pemvidutide treatment significantly reduced liver fat content compared to placebo. Pemvidutide treatment significantly reduced non-invasive biomarkers of liver inflammation. Pemvidutide treatment significantly reduced body weight. Pemvidutide may be an effective treatment for MASH. The next article. Induction of steatosis in primary human hepatocytes recapitulates key pathophysiological aspects of metabolic dysfunction-associated steatotic liver disease. Increasing prevalence of MOSLD warrants new cellular models for drug development. In vitro model of steatotic primary human hepatocytes recapitulates MOSLD phenotypes. Forsocostat rescued steatosis and insulin resistance, providing proof of concept. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Unveiling cancer-related metaplastic cells in both Helicobacter pylori infection and autoimmune gastritis. Background and aims. Gastric metaplasia may arise as a consequence of chronic inflammation and is associated with an increased risk of gastric cancer development. Although Helicobacter pylori, HP, infection and autoimmune gastritis, AIG, both induce gastric metaplasia, possible distinctions in resulting metaplastic cells and their respective cancer risks requires further investigation to conclusion. Both HP infection and AIG trigger a diverse array of metaplastic cell types. Identification of a cancer-related metaplastic cell uniquely expressing ANPEP CD13, present in both HP and AIG-induced gastritis, indicates the carcinogenic capacity of both diseases. This discovery can guide early detection and risk stratification for patients with chronic gastritis. Here are the articles from Clinical Gastroenterology. Satisfaction with and adherence to off-label corticosteroids in adolescents and adults with eosinophilic esophagitis. Results of a web-based survey in the United States. Goals. We assessed satisfaction with and adherence to off-label corticosteroids in patients with eosinophilic esophagitis, O, in the United States. Background. O is a chronic inflammatory disease for which there are currently no U.S. Food and Drug Administration approved swallowed topical corticosteroids. Conclusions. Satisfaction with and adherence to off-label corticosteroids were low in this web-based survey of adolescents and adults with O in the United States. Next, we will be discussing articles in the field of infectious diseases. Here are the articles from Clinical Infectious Diseases. Epidemiology and prognostic factors associated with mold-positive blood cultures. 10-year data from a French prospective surveillance program, 2012 to 2022. Background. While invasive fusariosis and lomentosporiosis are known to be associated with fungemia, overall data on mold-related fungemia are limited, hampering early management. This study aimed to describe the epidemiology of mold-positive blood cultures. Conclusions. Underlying conditions and clinical presentation vary between genera and could be considered to guide early management. Next, we will be discussing articles in the field of rheumatology. Frequency of spondyloarthritis symptoms among U.S. patients with inflammatory bowel disease, a cross-sectional multi-center study. Objective. Spondyloarthritis, SPA, is the most common extraintestinal manifestation of inflammatory bowel disease, IBD. The application of screening tools to detect SPA in patients with IBD may lead to earlier recognition of SPA and affect treatment decisions. Conclusion. A substantial proportion of patients with IBD have symptoms suggestive of SPA, and many of these may have undiagnosed SPA. The IBIS-Q questionnaire appears to identify more potential SPA cases than detail. Strategies are needed to prioritize rheumatology consultations for those patients with IBD who are most likely to benefit. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Sickle, trait and alpha thalassemia increase NOS-dependent vasodilation of human arteries through disruption of endothelial hemoglobin-eNOS interactions. Background. Severe malaria is associated with impaired nitric oxide, NO, synthase, NOS-dependent vasodilation, and reversal of this deficit improve survival in murine models. Malaria might have selected for genetic polymorphisms that increase endothelial NO signaling and now contribute to heterogeneity in vascular function among humans. One protein potentially selected for is alpha-globin, which, in mouse models, interacts with endothelial NOS, to negatively regulate NO signaling. Wheeze, we, ul, we, or sought to evaluate the impact of alpha-globin gene deletions on NO signaling and unexpectedly found human arteries use not only alpha but also beta-globin to regulate NOS conclusions. Alpha and beta-globin subunits of hemoglobin interact with eNOS to restrict NO signaling in human resistance arteries. Malaria protective genetic variants that alter the expression of alpha-globin or the structure of beta-globin are associated with increased NOS-dependent vasodilation. Targeting the hemoglobin-eNOS interface could potentially improve NO signaling in diseases of endothelial dysfunction, such as severe malaria or chronic cardiovascular conditions. Here are the articles from Journals of the American College of Cardiology. Drug-coated balloon angioplasty of the side branch during provisional stenting. The multicenter randomized DCB-BIF trial. Background. Side branch stenting is often required during provisional stenting, leading to suboptimal results. Drug-coated balloons, DCB, for the compromised side branch have emerged as an attractive strategy. However, the benefit of DCB for coronary bifurcations remains unclear. Conclusions. In patients with simple and true coronary bifurcation lesions undergoing provisional stenting, main vessel stenting with a DCB for the compromised side branch resulted in a lower one-year rate of the composite outcome compared with an NCB intervention for the side branch. The high rates of periprocedural myocardial infarction, which occurred early and did not lead to revascularization, are of unclear clinical significance. From JAMA Cardiology. Microaxial flow pump. Hemodynamic and metabolic effects in infarct-related cardiogenic shock. A sub-study of the Dan-Gare shock randomized clinical trial. Question. Does the use of a microaxial flow pump, MAFP, reduce the need for pharmacological circulatory support? And what are the effects on hemodynamics and lactate clearance in patients with ST elevation myocardial infarction-induced cardiogenic shock, STEMI-CS? Findings. In this sub-study of the Danish-German, Dan-Gare, shock randomized clinical trial involving 324 patients with STEMI-CS admitted to the intensive care unit, the MAFP group had significantly lower vasoactive inotropic scores during the first 12 hours compared with the standard care group, without compromising hemodynamics. In addition, MAFP was associated with significantly faster arterial lactate clearance compared with standard of care, meaning results suggest that the use of MAFP reduced the need for pharmacological circulatory support, while maintaining hemodynamic stability in patients with STEMI-CS. Next we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Regional adiposity and insulin sensitivity, interactions with menopause and HIV in middle-aged Black African women. Objective. To explore depot-specific functional aspects of adipose tissue, examining the putative role for menopause and HIV status on insulin sensitivity, SI, and beta cell function in Black South African women. Conclusion. Insulin sensitivity and beta cell function were distinctively associated with ASAT and GIASAT. While menopause did not influence these relationships, HIV had a significant effect on adipose tissue, characterized by variations in cell size distribution and transcript levels within the depot. Next we will be discussing articles in the field of neurology. Patient-relevant digital motor outcomes for clinical trials in hereditary spastic paraplegia type 7, a multi-center PROSPECT study. Background and objectives. With targeted treatment trials on the horizon, identification of sensitive and valid outcome measures becomes a priority for greater than 100 spastic ataxias, while digital motor measures assessed using wearable sensors are considered prime outcome candidates for spastic ataxias. Genotype-specific validation studies are lacking. We here aimed to identify candidate digital motor outcomes for spastic paraplegia type 7. SPG7. One of the most common spastic ataxias that 1. reflect patient-relevant health aspects, even in mild, trial-relevant disease stages. 2. are suitable for a multi-center setting. And 3. assess mobility also during uninstructed walking simulating real-life discussion. We here identified trial-ready digital motor candidate outcomes for the spastic ataxia SPG7, with proven multicenter applicability, ability to discriminate patients from controls, and correlation with measures of patient-relevant health aspects, even in mild disease stages. If validated longitudinally, these sensor outcomes might inform future natural history and treatment trials in SPG7 and other spastic ataxias. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. A 1-year weight management program for difficult-to-treat asthma with obesity. A randomized controlled study. Background. Obesity-associated asthma results in increased morbidity and mortality. We report 1-year asthma outcomes with a weight management regimen. The Counterweight Plus program, CWP, compared with usual care, UC, in a single-center, randomized controlled trial in patients with difficult-to-treat asthma and obesity. Research question. Can use of the CWP result in improved asthma control and quality of life compared with UC at 1 year in patients with difficult-to-treat asthma and obesity? Interpretation. In this study, the use of a dietitian-supported weight management program resulted in sustained weight loss and is a potential treatment for obesity in asthma. The CWP resulted in a higher proportion achieving MCID improvements in AQLQ compared with UC. Within group differences in AQLQ and exacerbation frequency suggest potential with the CWP. These encouraging signals justify a larger sample study to further assess asthma-related outcomes. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Association of dose of inhaled corticosteroids and frequency of adverse events. Rationale. Inhaled corticosteroids, ICSs, are the cornerstone of asthma treatment and significantly improve morbidity and mortality. Adverse effects of oral corticosteroids are well documented, but less is known about ICS. Objectives. The aim of this study was to determine the risk of adverse effects from short-term ICS use in people with asthma. Conclusions. Short-term use of low-dose ICS was not associated with adverse effects. Moderate to high daily ICS doses were associated with an increased risk, but low frequencies, of cardiovascular events, PE, and pneumonia. It is important for clinicians to adhere to guideline recommendations to use the lowest effective ICS dose. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Impaired incretin homeostasis in non-diabetic moderate to severe CKD. Total incretin levels and incretin response during oral glucose tolerance testing were significantly higher among patients with moderate to severe non-diabetic patients with CKD compared with healthy people. Unlike in healthy individuals, increased incretin response was not correlated with insulin response and coincided with persistently greater glucagon levels to oral glucose tolerance testing in CKD. Disruption in the incretin system and glucagon dynamics may contribute to metabolic complications in moderate to severe CKD. Here are the articles from Kidney International Reports. Outcome of patients transplanted for C3 glomerulopathy and primary immune complex-mediated membranoproliferative glomerulonephritis. Introduction. Approximately 50% of patients with C3 glomerulopathy, CEG, and primary immune complex-mediated membranoproliferative glomerulonephritis, IC-MPGN, reach kidney failure 10 years after diagnosis. Because these patients are generally young, the majority will be listed for kidney transplantation, KTX. However, reported outcomes in patients transplanted for SEG and IC-MPGN are heterogeneous and conflicting, because they are mainly based on retrospective monocentric studies. We thus aimed to provide detailed multicenter data on these patients, taking advantage of the ongoing nationwide Swiss transplant cohort study, STCS. Conclusion. This study provides important insights into the epidemiology and outcome of patients with SEG and IC-MPGN and their grafts after KTX. The data also suggest that proteinuria may serve as an early biomarker of disease recurrence and should be considered in patient management as well as an endpoint in current clinical trials using novel complement modulators.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.